Welcome in hematological section of human physiology. I am Dr. B.K. Prasad. Today I will talk about WBC. What is WBC? What is WBC? Blood is composed of plasma and cells or form elements of blood. This is known as form elements of blood. Plasma is 55% and cells are 45%. Cells are of three types: RBC, red blood cells, WBC, white blood cells, and platelets. So it is clear that WBC, what is WBC? WBC is a type of cell present in blood. This is WBC. Now, WBC is divided into two groups, granular and agranular, depending upon the presence or absence of granules, specific granules rather, in the cytoplasm, specific granules in the cytoplasm. Granular cells contain granules, specific granules in their cytoplasm. There are three types: neutrophil, eosinophils, and basophils. And agranular, they are in agranular cells in cytoplasm there is no granule. And therefore it is agranular. Agranular, monocyte and lymphocyte. Lymphocyte is of two types, a small lymphocyte and large lymphocyte. So we may say that it is of WBC is of five types: neutrophil, eosinophil, basophil, monocyte and lymphocyte. Now, what is the characteristic of neutrophil? Neutrophil, size of these cells are 10 to 14 micron. Okay? And size of this large lymphocyte is also 10 to 14 micron, and this is 7 to 10 micron. Monocyte is a bit larger, 14 to 18 micron. Okay? Now, cytoplasm of neutrophil contains granules, fine granules, acidophilic granules and basophilic granules. What is the meaning of acidophilic granules? That granules are take a stain, eosinic stain, and becomes red and blue. That is basophilic granules. Fine granules, basophilic granules are present. They stain with basic dyes. Their color is blue. This is neutrophils. Characteristic of neutrophil: size. Neutrophil characteristic number 1, size is 10 to 14 micron. Number 2, cytoplasm has granules, fine granules, mixed type of granules, therefore it is known as mixed. That is eosinophilic as well as basophilic granules are present. And nucleus is multi-lobe, 2 to 6 lobe. Nucleus is 6 lobe. This characteristic of neutrophil. And percentage is say 50 to 70%. When it is less than 50%, 50 to 70% means when we count 100 WBC cells, then we may get 50 to 70% neutrophils, normal. And when it is less than 50%, then it is known as neutropenia. And when it is more than 70%, then it is known as neutrophilia. Okay, clear? Now, another cell is eosinophil. Eosinophil size is 10 to 14 macron. Cytoplasm contains eosinophilic. Cytoplasm contains eosinophilic granules, that is red granules. Nucleus is bilobe and it appears like this, as spectacles. This is eosinophil. Nucleus is bilobe and percentage is cytoplasm contains eosinophilic granules and nucleus is bilobe, appears as a spectacle, and it is 2 to say 6%. So, this differs in different books. We take it 2 to 6%. When it is less than 2%, then it is known as eosinophenia. When more than 6%, eosinophilia. Simple, eosinophilia. Now coming to basophils. Basophil size is again basophils. Size is 10 to 14 micron. Cytoplasm contains coarse blue granules. Basophilic granules. Blue, that is, contains basophilic granules. Nucleus is also bilobe, but it is different. It is just like this. Seems to be bilobe, and it is a slightly different from that of this eosinophil. Nucleus is and granules of basophil covers the nucleus incompletely, but it covers, and its normal count is 0 to 2%. When it is less than 2%, more than 2%, it is known as basophilia, and in some cases maybe basopenia. But 0%, as it is 0%, therefore it is very hard to say basopenia is present or not. This is 2% basophilia. Okay, more than 2% is basophilia. Now coming to monocyte. Monocyte is 14 to 18 micron. It is 14 to 18 micron. Monocyte is size is 14 to 18 micron. Nucleus is kidney separated. And cytoplasm contains no specific granules. Or nucleus is kidney separated. Nucleus is somewhat kidney separated. It is 4 to 10%, and when it is more than 10%, then it is known as monocytosis, and less than 4%, then monocytopenia. Lymphocytes again, size is variable. A small lymphocytes a small is 7 to 10 micron and large is 10 to 14 micron. Okay, and cytoplasm contains no special granules, and nucleus is large and round, and it is about 20 to 30%. What is the percentage? 20 to 30%. And when it is more than 30%, then it is known as lymphocytosis, and when it is less than 20%, it is lymphopenia. Okay, this is about the different types of WBC. What are the different types of WBC? Number 1, neutrophil. You may say directly, or you may say it is of two types, granular and agranular. In granular, neutrophil, eosinophil, basophil, and in agranular, monocyte and lymphocyte. You may say 5 types of WBC are there. neutrophils, eosinophils, basophils, monocytes and lymphocytes. What is the normal count of WBC? Normal count of WBC is normal range is 4 to 11,000 per cubic millimeter of blood. Normal count is 4 to 11,000 per cubic millimeter of blood, and it is in thousand. Okay, and when this is less than 4,000, when it is less than 4,000, then it is known as leucopenia. Leucopenia, less than 4,000, and when it is more than 11,000, then it is known as leucocytosis. Okay, yeah. I think it is clear. So in this lecture, I am able to show you or answer your question: what is WBC and what is normal range of WBC, what are the cells of WBC, and what are their characteristics, how you will recognize the different types of WBC and their percentage. Normal range is clear. Okay, then let us move for another class. In another class, I will talk about leucopoiesis, that is formation of WBC, in some detail. I think if you like it, then please like it, share it, and subscribe my channel and use it in your day-to-day practice and in examination also. You may make pictures like this to clear your vision. Okay, thank you very much.